Well, tonight on Health Nuggets, our focus is on fibroid. It is a condition that affects a number of women, and with the help of Dr. Jane Wavinya, who is a general practitioner, we'll just be looking at the causes, the signs, and most importantly, treatment, management, and of course, prevention. My name is Aida Muzati, and of course, Health Nuggets starts now. Fibroids are abnormal growths in or around the uterus that can cause pain, heavy bleeding, and fertility problems for some women. They are made of muscles and fibrous tissue that can vary in size from a grain of rice to a melon. They can also grow on stalks or inside the uterine cavity. Fibroids are not cancerous and do not increase the risk of cancer, but they can sometimes cause complications such as infections, bleeding, or blockage of the urinary or bowel system. The exact cause of fibroids is unknown, but they may be influenced by hormones, genetics, and environmental factors. They are more common in women of African descent and in women who are overweight or have never given birth. Fibroids often do not cause any symptoms and may shrink or disappear over time, especially after menopause. However, some women may need treatment to relieve their symptoms or improve their chances of pregnancy. Medication, surgery, or minimally invasive procedures can treat fibroids depending on their size, location, number, and women's health and goals. Now, Daktari, for starters, we'll just first of all want to understand what exactly fibroids are.
Okay. So fibroids are benign tumors which grow in the uterus, and usually they grow over a period of time. Sometimes there may be many, sometimes it just may be one. Usually it can cause symptoms such as heavy menstruation, painful periods, intermenstrual bleeding, and also infertility. Yes, usually they occur mostly in African women, and they cause infertility, and at around 30 to 40% of causes of infertility is fibroids. Yes.
Okay. And now when we are looking at, you've just mentioned over the signs and definitely a bit of the cause.
Yes.
When we are talking of now the growth, where exactly do they grow?
They grow within the uterus. Sometimes they may be serosal, meaning that, okay, the uterus has three parts. There's endometrium, the myometrium, and the perimetrium, and they grow in either of the layers of the uterus. So sometimes they may be having a stalk, and we call them pedunculated. Yes. For example, as we can see in this image, there's one that is submucosal, just below the endometrium. The second one is intramural, and it's in the myometrium, and subserosal, which is in the perimetrium. They can occur as huge as the subserosal one, and they can cause disruption of the menstruation periods and causing heavy menses. They can also cause very painful periods. Sometimes if they're very big, they can cause pressure on the bladder and cause urinary symptoms, meaning that you'll be going to empty your bladder every other time. That can cause discomfort, and they're sometimes very painful. Yes.
Okay. So pain probably will be one of the signs.
Yes.
As you mentioned, depending on the different areas where they grow.
Yeah.
So will they start presenting the signs immediately, or do they take time depending on how big they are?
They take time depending on how big they are. As they start, they're small, and then as they proceed, they become bigger. Yes.
And definitely that's when the signs begin to show.
Yes, then the signs begin to show, and you start seeing that your periods are heavier than normal. They are more painful than normal, and you're having intermenstrual bleeding, sometimes even postcoital bleeding, meaning that you bleed sometimes after sex. Yes. Yeah.
Okay, and what other signs would you say now fibroids present themselves with?
As I've mentioned, the urinary symptoms, sorry, where you keep emptying your bladder, you see abdominal distension. If they're big, you can actually feel them. When you touch your lower abdomen, you can feel some irregularities of a mass that could be mobile or immobile. Yes.
Okay, so the signs will be painful menses.
Painful, yes.
You can feel. Then you talked of bladder.
Yes, you urinate frequently because of the pressure that is applied to the bladder and its proximity to the bladder. So if the fibroids are huge, then they put pressure on the bladder, and that means that the bladder will not get full completely, so you have to keep on emptying it frequently. So when you get this bleeding a lot and for a period of time, you can get anemic. And you start getting tired, you have difficulty in breathing sometimes when you just do a small amount of work or just a flight of stairs. Yes, those are the symptoms that you can have. Yeah.
Okay, and what causes, you mentioned of it being more prevalent in African women.
Yes.
Yeah, so the fact that you're a woman will say it's a cause, and the fact that you're an African woman, of course, increases your chances of fibroids.
Yes.
What other causes would you say?
Other risk factors would be obesity can facilitate or lead to fibroids. Family history of fibroids is when you have a family history, you can have fibroids, and also polycystic ovarian disease can also lead sometimes to fibroids. Yes.
Okay, so by family history, we mean probably if I had someone in my family that had a fibroid, the chances of me having them are high.
Exactly.
Okay.
Yes.
Okay, and now, how about now the age? The
age factor usually approximately from 25 to late 40s even. And at 25 you might not even get the symptoms. Sometimes they are asymptomatic if they're not big, but once they're big they cause a lot of havoc. Yes.
Now, talking of asymptomatic, of course, probably if it doesn't present the signs, I'll want to let me say prevent. Are there checkups that are done to someone, just even if the symptoms are as mild as possible?
Yes.
Do we have checkups that are done just to check if they are fibroids or probably it's other medical conditions?
Definitely. When you go for a general checkup, one of the most important checks to do is your ultrasound, your pelvic ultrasound, where you're able to visualize your pelvis, your uterus, basically the reproductive system, and if you find the fibroids there, it could be incidental sometimes if you're asymptomatic, and if you're asymptomatic, then there's nothing that needs to be done immediately unless they grow bigger and they start disrupting your life in terms of now the heavy menses or your fertility is not at par.
Okay, and when we are talking of heavy menses,
yes,
how heavy are these? Are the menses, or are we also looking at probably the regular and irregularity of menses?
Well, there's the heaviness and also irregularity of the menses at the same time. Heavy menses means that you're losing more than around 80 ml per period. Usually in normal circumstances we lose 30 to 80, but if it's more than that, then there could be a problem. So how do we measure that, since we don't have those measuring cups or tools? We do that by seeing how we are changing the pads, how frequently we're changing the tampons. Yes.
Okay, so you talked of the causes of now these fibroids you mentioned, or the risk factors, let me say.
Yes.
Are there any other, let me say, external risk factors we are talking of? Would you say contraceptives would also lead to one developing fibroids? Or?
No, on the contrary, the contraceptives help in regulating the menses during the irregularities that are caused by the fibroids. Yes.
Okay, so in most cases there are internal factors, or
yes, it's just the internal factors. There are those that are modifiable, meaning that you can change, especially like obesity, you can lose some weight. But there are those that are non-modifiable, such as the family history. You really can't change that. You have that predisposition. Being a black woman is definitely a risk factor. Yeah.
Okay, now let us look at to a woman that has already been diagnosed with fibroids.
Yes.
First of all, how do you do the diagnosis?
Well, we get the history. When you come to the office and tell me how your menstrual periods have been, I will note that they are irregular, they are very heavy, and once we get the history, we do an examination on the patient where we examine the abdomen. If the fibroids are huge, then we're able to feel it during the examination. So to confirm the diagnosis, we send someone for an ultrasound, where the pelvic ultrasound is done and it shows the area where the fibroid is and how big it is. Another thing we do is a blood test to check full hemogram, which checks the level of your blood, the hemoglobin that is, and most of the time it's lower than normal because of the loss of blood that has been there for some time. Yeah.
Okay, and there's the test that is done, let me say, for cervical cancer, just to screen for cervical cancer. Now, in terms of the signs, would you say probably the fibroid signs will mimic cervical cancer signs, or are they related in any way?
They're not related. Cervical cancer is totally different.
Okay.
And fibroids are also different. But sometimes they may have some similarities in terms of their symptoms. For example, in the heavy menstruation and intermenstrual bleeding, especially intermenstrual bleeding. In cervical cancer, you get intermenstrual bleeding, and this usually is mostly post-coital, post-sex. You get the bleeding. Sometimes also now in fibroids you get the same. Yeah. But other than that, when you're doing your cervical pap smear, you might not know whether you have fibroids. Yeah.
Okay, and now after the diagnosis, after you've checked, what next in terms of treatment?
Now there are different modalities of treatment. For the asymptomatic fibroids, we don't do anything much. We watch and wait. Now when they become big and they are causing now the heavy menstruation and also painful periods, intermenstrual bleeding and infertility, then that's when we intervene. There are different modalities of interventions. There is medication. Medication to regularize the period, such as oral contraceptives, can be used to reduce or to normalize the periods. Secondly, there are some drugs that cause early menopause, which can now reduce the sizes of the fibroids. But that also depends on your desired effect. Do you want to get kids later in life? Are you in the reproductive stage where you want more kids? Maybe you've had kids before, but you want also more. So we have to preserve the uterus. Another one is surgical. The surgical intervention, such as myomectomy, meaning that the removal of the fibroids through surgery. It could be laparoscopic, meaning that it's minimally invasive, or laparotomy if they're very huge. Yes, that can happen, and then you still maintain the uterus, and now you're able to carry a full pregnancy. The other one is hysterectomy, where your uterus is fully removed. So that one is a permanent solution, but mostly it's done to the patients who don't have a desire to have children. Yes. There's also another minimally invasive procedure called uterine artery embolization, meaning that the blood supply to the fibroids is cut off surgically, and that causes shrinking of the fibroids, and now someone is able to conceive. Yeah.
Okay, I'll just take you back to when you say when the fibroids are small, like there's nothing that can be done, so you have to wait and see.
What I meant is, if they're small and they are asymptomatic,
Okay.
then you can choose to remove them or not. Sometimes they're very small and they're not even causing any symptoms, and sometimes they may remain small. Yes, so we don't do much about that. We wait.
Okay.
Yeah.
So let's say once the treatment plan where you just remove and not necessarily touch the uterus, the chances of probably them redeveloping again, what are the chances of that, or what can someone do so that they do not develop again?
Well, there's a recurrence percentage actually, so they recur. So you're given the total, or rather the permanent solution is hysterectomy, removal of the uterus. Yes, but if you want kids, you're given a period of time before they regrow to have the children, and then if they regrow, then you can have the hysterectomy done, or if they don't, you just leave them. But there's for sure a rate of recurrence that is there. Yeah.
All right. Thank you so much for that. Probably if there's any other thing that you want to add.
Yes. The solution to fibroids, mostly in the ladies who want to have a fertility, to have children later, would mostly be the uterine artery embolization. It's a good solution where there's it's minimally invasive first, and it sorts out the fibroids, meaning that the blood supply to the fibroids is cut off, and when it's cut off, it reduces the size of the fibroids. Hence, now you're able to conceive. So that is a good solution, because the first thing might not be hysterectomy. If you're not ready for a complete removal of your uterus, then you can consider other solutions which are less invasive and also have desired results. Yeah.
All right, thank you for that. Now, just looking at the camera, I'll want you, because the most important bit will be prevention, and you also being able to identify the signs.
Yes.
So if you can just repeat the signs, and also just a take home to a woman who is watching.
Okay. So we're talking about the fibroids, and the signs would be heavy menstruation, which lasts more than 7 days, which is very heavy, and sometimes you get intermenstrual bleeding. That intermenstrual bleeding might be either postcoital or just random, and when you see such signs, you need to come to the hospital, and we check what's happening. We'll do an ultrasound, we'll do a full blood count to check your level of your blood, to check whether you have anemia, and to check how big the fibroids are. And a good solution to those patients or to that woman who would want to have children later is to have uterine artery embolization, which is a minimally invasive procedure, which also reduces now the size of the fibroids, and then you're able to conceive. Yes.
All right, thank you so much for that, and thank you for educating us as far as the fibroids are concerned.
Yes.
Well, that was Dr. Jane Wavinya, who just helped us understand as far as our fibroids are concerned. We've looked at what exactly fibroids are. We've also looked at the causes or the risk factors, as well as the signs, and most importantly, treatment and prevention. Thank you so much for tuning in. That's all we had for you on Health Nuggets. My name is Aida Munzati, but as always, your health matters.
Fibroids are abnormal growths in or around the uterus that can cause pain, heavy bleeding, and fertility problems for some women. They are made of muscles and fibrous tissue that can vary in size from a grain of rice to a melon. They can also grow on stalks or inside the uterine cavity. Fibroids are not cancerous and do not increase the risk of cancer, but they can sometimes cause complications such as infections, bleeding, or blockage of the urinary or bowel system. The exact cause of fibroids is unknown, but they may be influenced by hormones, genetics, and environmental factors. They are more common in women of African descent and in women who are overweight or have never given birth. Fibroids often do not cause any symptoms and may shrink or disappear over time, especially after menopause. However, some women may need treatment to relieve their symptoms or improve their chances of pregnancy. Medication, surgery, or minimally invasive procedures can treat fibroids depending on their size, location, number, and women's health and goals.